Hello, everyone. Our topic for today's whiteboard to boardroom presentation is early oral cancer detection. Hi, my name is Rose Wang. I'm an assistant research professor at the UMKC School of Dentistry. I received my PhD from the Harvard-MIT Division of Health Sciences and Technology in 2005. My PhD training was in the biophysical research of cancer. Before joining UMKC in 2018, I worked in two startup companies in California, where I developed and commercialized an internationally patented technology as a co-inventor and chief science officer. My current research focuses on early detection of oral cancer using a novel biospectroscopy technique combined with artificial intelligence. My collaborator, Dr. Wang, is a tenured professor at the UMKC School of Dentistry. He has more than 20 years of experience in oral and dental tissue and biomaterial research. He published about 170 papers in peer-reviewed journals and was recently elected as a fellow of American Association for Dental, Oral, and Craniofacial Research. The problem we are trying to solve here is early detection of oral cancer. Why is it important? Oral cancer is a type of head and neck cancer that affects the lip and intraoral cavity. It is the 8th most common cancer worldwide. 90% of oral cancer is oral squamous cell carcinomas, or OSCC, which is a very aggressive cancer that tends to spread quickly to other parts of the body. Despite easy access to oral cavity and advancement in treatment strategies, oral cancer is still characterized with a low 5-year survival rate of 50%, mainly due to late diagnosis, which underscores the importance of early oral cancer detection. Oral carcinogenesis is a highly complex, multifactorial, and multi-step process. The progression of oral cancer can start from benign hyperplasia and evolve through oral epithelial dysplasia, or OED, carcinoma in situ, and finally to invasive OSCC. OED is a precancerous lesion with the presence of abnormal cells. It is not cancer, but has an increased risk of progression to OSCC. Oral cancer survival is highly dependent on the diagnostic stage. For invasive OSCC that has spread to distant locations, the survival rate is as low as 20%. While early detection can significantly improve patient survival to more than 90%. The gold standard histopathological diagnosis of oral disease relies on subjective evaluation of the morphological and structural changes of oral tissue under a microscope. It has a big inter- and inter-observers variability. Unfortunately, this approach cannot provide an accurate risk assessment for individual precancerous oral lesions, leading to challenges in OED management and a delay in oral cancer diagnosis and intervention. Here, we propose a novel solution using an intelligent biospectroscopy approach called FTIR. Compared to the gold standard histopathology, in which the diagnosis is made subjectively by a pathologist based on the morphological changes of biopsy tissue, as illustrated on the top. The novel approach detects molecular-level biochemical information of the biopsy tissue using FTIR, and the diagnosis is made by machine learning algorithms objectively and quantitatively, as illustrated on the bottom. FTIR stands for Fourier transform infrared spectroscopy. It provides a biochemical profile of lipids, proteins, nucleic acids, and carbohydrates of the sample in the form of characteristic FTIR spectrum called biomolecular fingerprinting. FTIR biomolecular fingerprinting has been shown to detect early cellular changes associated with malignant transformation long before the emergence of morphological abnormalities, supporting its potential in early cancer detection. Using FTIR imaging, we successfully trained a machine learning classifier with 100% accuracy in discriminating OSCC from benign oral tissues in our preliminary study. More excitingly, our results demonstrated that the classifier was also able to classify the precancerous OED samples into two subgroups based on their FTIR fingerprint similarities to either the OSCC tissue or the benign tissues. Our preliminary results led to a hypothesis that the OSCC-like OED samples could carry a higher risk of malignant transformation than the benign-like OED samples due to their biochemical similarity to the OSCC tissue. The next step is to improve the machine learning algorithm using a larger sample size and to test the feasibility of this novel approach in OED risk stratification using clinical transformation outcomes. We submitted an R03 and an R21, a grant application to the National Institutes of Health in early 2022 and expected to hear the outcome in August 2022. Meanwhile, the UMKC Innovation Center filed a provisional patent application for this technology in early 2022. For future work, we plan to carry out a large-scale, multi-center clinical study to prove that the FTIR machine learning technique can indeed provide a novel solution for accurate risk assessment of oral precancerous lesions and facilitate early oral cancer detection. In order to do that, we will need external funding from the government or private sector and hundreds of cases from multiple centers. Advanced machine learning algorithms and portable FTIR instrument will be developed to facilitate clinical integration. Other promising applications of this technology include oral cancer prognosis prediction, early detection of other oral diseases, early detection of other epithelial cancers, drug-cancer interaction, and other applications in bone and biomaterial research. This is Rose Wang. Thank you for your time and attention.